I'd like to first ask Dr. Gordon a question. The question is when the COVID pandemic began, we knew relatively nothing about this virus. That's why they called it novel. And as a result, we began just guessing what might reduce or even enhance the risk of getting a serious infection or even death, such as things like obesity or low testosterone, or even blood type was pandered around as being a potential benefit or risk factor. So where are we now after all of this tentative research?
Well, thank you, Dr. Lutz, and thank you for having me along with Dr. Grant. I'm honored to be here. We can separate risk factors into a lot of issues, host factors, epidemiologic, social risk factors, and then factors related to the virus itself. So there's a lot of different issues that we've learned about different pieces that will make us more at risk to have more severe disease. So the same things that make us at risk for a lot of other medical issues also place us at increased risk for increased severity of disease with COVID. So for example, the elderly, that's the number one group that we've identified, and that's throughout the pandemic, been the people that are most at risk for most severe outcomes. But also we've seen obesity, patients with high blood pressure and diabetes, patients with underlying heart disease, atrial fibrillation, and patients that are immune compromised, patients that are getting cancer, chemotherapy, patients that have underlying immunologic illnesses, patients with chronic kidney disease. All those features place people at increased risk for getting more severe disease. And it seems that if you have multiple risk factors, that certainly would put you at more risk. In addition to that, pregnancy. Okay, initially, and I know this group doesn't have a lot of pregnant patients, but they know a lot of pregnant patients. And we have found that even though pregnant patients tend to be young people, severity of disease in pregnancy can be quite significant. We all know the people that have underlying lung disease, patients that have underlying emphysema, cystic fibrosis, pulmonary fibrosis, or severe asthma are at increased risk for getting severe disease. And that's why those patients, we're talking about use of convalescent plasma, which is one of the medications that we can use for patients very early, not convalescent, but monoclonal antibodies, very early on in disease to prevent people from getting severe disease. We included patients with significant asthma in the eligibility for use of that agent. Children, fortunately, have been less affected. And with influenza, for example, children are at increased risk, especially very young children are at increased risk for severe disease. But as it turns out with COVID, the risk is much lower, although there are a subset of children that become very, very ill. And they refer to that as the MIS-C, the multi-system inflammatory syndrome in children that can make children quite ill. Otherwise, social factors, and we've looked at social economic factors, race and ethnicity placing people at risk. We know that for example, people of color, especially very early on in the pandemic, seem to have very large disproportionate involvement of disease and severe disease. And that probably was in large part related to some potentially lower socioeconomic status, decreased access to healthcare, which is an important issue in this world, and then exposure to virus-related occupations where they may have been essential workers and been continuing to work. They didn't have the luxury of working from home on the computer all the time. And then lastly, there's virus issues. Okay, so when this all first started, it was all wild type virus, the original virus that started in Wuhan. But as with any other virus over time, especially when there's a lot of virus circulating in people, we develop variants. In influenza, they call it antigenic drift, okay? And what happens then is that over time, any organism that's multiplying will have errors in the genes when they replicate, when they grow and divide. Most of these actually make the virus less fit, so they're less effective at doing what they do. But every once in a while, it makes a gene change that will make it more contagious, for example. That spike protein that you've heard about, it'll be more likely to go and penetrate quicker, or which can make the disease much more contagious. And actually some of these variants we've also found to be more severe disease, so more virulence. So there's a lot of issues, Dr. Lutz, that can be associated with increasing risk for more severe disease, but that's kind of a capsule of it.